Hi everybody. Bonjour à tous. Merci d'être avec nous aujourd'hui. It's really nice to have everybody in Milton. Welcome to Milton. If you're from Milton, you work in Milton, then it's, thank you for being such a warm host as we always are. And if you're not from Milton, thank you for joining us today. My name is Adam van Koeverden, and I'm the Member of Parliament for Milton. And I'm very proud that everybody's joined us today on the traditional territory of the Haudenosaunee, the Huron-Wendat, the Ottawa-Darin, the Anishinaabe, and most recently the Mississaugas of the Credit First Nation. And as always, we are very glad to be sharing this land together. I'm so delighted that this event is happening here in Milton. Communities across the country have pitched in to support each other, to be there for one another, to provide their expertise in the fight against COVID-19, and that's absolutely true here in Milton as well. I want to take just a moment, a personal opportunity to thank everybody here that played such a phenomenal role over the past year and a half in the fight against COVID-19, locally, across the country, and truly across the world. The Olympics are going on right now, and that's the world I come from. And the world that I come from really relies on teamwork. And there's so many people behind the scenes. And you know, in that context, whether you're doing massages, helping with mental health preparations, you know, filling up water bottles, carrying boats and bikes, it really is all hands on deck, and it has been in Canada and across the world for the last year and a half. So from the bottom of my heart, from the bottom of all of our hearts, thank you. Merci beaucoup, miigwech. Joining us here today in Milton are the Honourable Anita Anand, Minister of Public Services and Procurement, the Honourable Patty Hajdu, Minister of Health, Mr. Guy Payette, President of Innomar Strategies, and we also have with us Fabien Paquette of Pfizer Canada, Patricia Gauthier of Moderna Canada, Jane Chung and Franz Dubé of AstraZeneca, and Denis Fredette of FedEx Express Canada. Aujourd'hui, le gouvernement du Canada annoncera une étape importante dans la réponse du Canada face à la pandémie de COVID-19. It's my pleasure to first welcome the Honourable Anita Anand, Minister, President of the world as far as I'm concerned, Minister of Public Services and Procurement, to make this special announcement. Madam President.
Excuse me 1 second. Thank you. It's just so wonderful to be here. Thank you so much, Adam. And thanks to all of you for taking the time out of your busy day to come to Milton, to Innomar, to share this special moment with us. I want to begin today by marking this milestone and thanking you for being here and for playing your part, as Adam mentioned, in the fight against COVID-19. Throughout this pandemic, we have rightly thanked our frontline healthcare workers. Through the first wave, through the second wave, through the third wave and beyond, now with vaccinations occurring across the country, we have been so grateful, and we will continue to be so grateful for the efforts that our frontline healthcare workers are making. Today, I would like to thank, with immense gratitude, another set of Canadians who have stepped up, and that's all of you here today and Canadians in the back rooms who are making sure that we are able to get vaccines into this country, out to the provinces and territories, so that they can be administered in vaccination centers across this country. Aujourd'hui, je tiens à remercier tout particulièrement les personnes qui travaillent dans les coulisses, y compris les nombreuses personnes ici présentes d'Innomar, de FedEx, car vous vous êtes mobilisés et avez relevé cet immense défi logistique. Thank you to Denis and Lisa from the FedEx team, as well as all of your teams, and Guy and the Innomar team, many of whom are here today, for your role in Canada's vaccine procurement effort. Now, to make sure that we could see Canada through to the other side of the pandemic, our government built a diverse portfolio of vaccines by entering into contracts with 7 vaccine manufacturers last summer. The strategy was first and foremost to put the contracts in place. But following the confirmation of contractual negotiations, we had to continue to press our suppliers to provide vaccines to Canada as early as possible. And so our strategy was one of negotiation and negotiation and negotiation even after those contracts were put into place. Between December 2020 and March 31st, 2021, we were able to exceed our target of 6 million vaccines by 3.5 million doses, so that we ended the first quarter with 9.5 million vaccines in this country. Then again, in the second quarter of this year, we targeted receiving 48 to 50 million vaccines in this country, and again, we closed out June with more than 50 million vaccines in this country. Our overall goal was to ensure that all eligible Canadians would have access to vaccines, prior to the end of September. And I am delighted to be here today to mark the arrival of more than 66 million vaccines in this country. And prior to the end of this week, we will see 68 million vaccines in Canada on home turf. This again surpasses our timeline by 2 months. And I would like to not only mark this milestone with you here today, but to thank you for the work that you have each done to make sure that we could get to this spot.
Nous avions dit que notre objectif était de disposer de suffisamment de doses d'ici la fin du mois de septembre pour vacciner complètement tous les Canadiens admissibles qui ont choisi de se faire vacciner. Et je suis ravie d'être ici aujourd'hui pour marquer l'arrivée de plus de 66 millions de doses de vaccins contre le COVID-19 au Canada.
And as the Prime Minister said earlier today, this major milestone means that we have now received enough doses to fully vaccinate every eligible person in this country.
Et grâce à l'effort exceptionnel de toutes les personnes investies dans cette entreprise, nous atteignons cette étape avec 2 bons mois d'avance de notre objectif initial. Cette étape n'a pas été franchie par hasard, mais grâce au travail acharné de nombreuses personnes, tant au sein du gouvernement qu'à l'extérieur et dans toutes les régions de notre pays.
It is really thanks to the efforts of so many people that we are here today. This did not happen by accident. It happened by hard work, cooperation, collaboration within and outside government. This has truly been a Team Canada effort. As Minister, I could not be more grateful. And I would like to acknowledge the work that my colleague, Minister Hajdu, and I have done throughout the past year and a half together, day in and day out, working together as a team. It's been a privilege to work with you, Patty. Thank you so much. Now, our strategy, as I mentioned, was to secure a diverse portfolio of vaccines, which, with apologies, I have spoken about very frequently. We did that on the advice of the Vaccine Task Force. And we assembled in Canada our supply of Pfizer-BioNTech, Moderna, and AstraZeneca, the first 3 vaccines that were authorized by Health Canada. And we pressed our suppliers repeatedly
to provide as many doses as early as possible. And I want to here acknowledge our suppliers, and in particular recognize Fabien from Pfizer, Patricia from Moderna, France and Jane from AstraZeneca for joining us here today. I lost count long ago how many times we had video calls and we exchanged texts and emails, and our teams were in touch. I mean, really, the number of times is innumerable. And so I'll just say here, thank you so much for your partnership. Thank you for listening to us when we were pressing the need for vaccines in Canada day after day, night after night, week after week, month after month. We are here because of a collective effort, and we appreciate your advocacy within your organizations on behalf of Canada to ensure that we could reach this milestone of 68 million doses in this country prior to the end of July. Thank you so much. I am very grateful. And because of our collective work, to date, more than 80% of eligible Canadians have received at least one dose of vaccine, and 64% are fully vaccinated. We are and have been at the top of the world for weeks in terms of the share of the population that has received a single dose of vaccine. And now Canada is at the top of the G20 in terms of the percentage of our population that is fully vaccinated. Ça, c'est incroyable. Et ça, c'est à cause du travail très, très fort de tous les Canadiens et Canadiennes. Après des mois de séparation, nous sommes nombreux à approuver la joie réelle de pouvoir renouer en personne avec les membres de sa famille, les amis, les voisins, les collègues. Le travail n'est pas encore entièrement terminé. We have more work to do. We have more work to do so that we can return to life that we knew it. We are on track, but we need to continue to ensure that Canadians across this country are being vaccinated. And I'm here today to tell you that the supply of vaccines is here. We have enough supply. Let us now continue to get shots in arms as quickly as possible. Et merci beaucoup, ça suffit pour moi aujourd'hui. Let's keep going. Team Canada, miigwech. Thank you.
Merci, Ministre Anand. Everybody was doing the math in their head as we heard 68 million, and that's indeed enough to vaccinate our entire country, which is fantastic news. And as I said previously, that just could not have happened without the extraordinary team effort. We're so fortunate to have amazing leadership throughout this pandemic, and we've all depended on weekly, sometimes daily updates from Minister Hajdu, and it's really our sincere privilege and pleasure to have you in Milton, have you back in Milton because you've been here before. Thank you for keeping us updated, for all of the work that you've done. Now, please join me in welcoming the Honourable Patty Hajdu, Minister of Health.
Well, thank you. I found myself getting emotional listening to Anita speak. I hope I can call you Anita in this esteemed audience, but it's been a journey, hasn't it? And I look at our incredible manufacturers and suppliers and the Team Canada people in front of us, and let me tell you, we are so grateful. We are so grateful because, in fact, many of you will have been obviously participating and listening to the conversation in early January and February where Canadians were scared. And in fact, your efforts to come through for this country have given Canadians a great deal of comfort and peace and knowledge that, that indeed we can get things done when we work together. And that's exactly what I have done with my colleague Anita day in and day out, as she's mentioned, often in the dreaded Zoom room, but nonetheless, those many, many conversations. It's wonderful to be here in Milton with Adam and Jennifer O'Connell, my incredible parliamentary secretary, who also, believe it or not, we've met many times prior to the pandemic, but was appointed as my parliamentary secretary during the pandemic. It's the first time I'm seeing her since, and I can't tell you how grateful I am for her efforts and work to help assist on this incredible, I think, privilege to serve Canadians. I'm from Thunder Bay, Ontario. It's the homeland of the Anishinaabe of the Robinson Superior Treaty Area, and I'm always so grateful to be able to say that. I live on the beautiful shores of Lake Superior, and I have seen in my own community and certainly all across Canada how Canadians have stepped up over the last year and a half to take care of each other. Aren't you proud to be a Canadian when you look at the efforts of our communities and the people in them to help each other, to make sure that we stay safe, often at great sacrifice to themselves? Small businesses closing for months on end, not knowing if they'll be able to open again or make it through financially. Of course, with the support of a federal government that believed we needed to keep as many businesses and people intact, there was some relief. But nonetheless, that anxiety of not knowing what the future holds, and yet day after day getting up and helping each other. Businesses and community groups feeding each other, reaching out to the vulnerable, housing people, working together to help protect each other and prevent the spread of COVID-19. I am so proud to be a Canadian every single day, but during this pandemic, I can tell you as a health minister, watching what Canadians did for each other, of course the frontline workers, but everyday citizens getting up every day and asking themselves, how can I help? What an incredible country we have. It's been a hard year, yes, but there have been all these moments of joy, actually, in helping each other, in knowing that we're making a difference, and being able to serve differently. You know, when I ran for office, I never thought that I would be a health minister in the middle of a global pandemic. I bet you, as suppliers and logistics folks, never thought that you would be doing something that critical to your country, that critical and that time sensitive and that urgent. And yet, here we all have had this incredible opportunity to serve our fellow Canadians, our country, and indeed the world for some of you. So we have to continue going because now, as Minister Anand points out, we have enough for everyone. That conversation is solved, but we also have to make sure that everyone gets vaccinated as quickly as possible. And so the work continues. We have to ensure that people have the support to get vaccinated, that people have the information they need to get vaccinated, and that we support community groups who are continuing to do that hard work of stepping up to talk to each other in each other's comfort place, their language, their culture. And so at Health Canada and Public Health Agency of Canada, we continue to support people through, for example, the Immunization Innovation Challenge, that is around making sure that community groups have the money they need to have those important conversations so that everybody feels safe and comfortable getting vaccinated. We want everybody to be safe, to be sure, and to help be part of that important work of stopping the spread. So that in the fall, when kids go back to school, something they've been missing tremendously here in the province of Ontario, there are as many of us protecting each other as possible so that our children are safe, so that our elderly are safe, so the vulnerable people in our communities are safe. And so the Prime Minister's announcement today, Minister Anand's announcement today, is a key ingredient in this. And the work that all of you have done to get this precious, precious tool to Canadians is incredible. But we have to keep going, and we have to continue to get people immunized, and we also have to continue to protect each other. And that's why, as much as I think we're all tired of public health measures that include smaller gatherings and wearing masks and doing those kinds of things that remind us of the pandemic and the sacrifices we've made, we need to continue till we get the job done. And I know Canadians will. So I want to thank you all. I want to remind Canadians that the best way that we can protect the people we love, including our children and the many small business owners and our families and all of those workers out there fighting so hard for all of us is to get vaccinated. Thank you very much again for your incredible efforts. We will not forget them.
Thank you, Minister Hajdu. As we're all kind of reopening, getting back to normal a little bit, we're all shaking off the nerves. This is my first time at a public podium in a year, and my hands are sweaty and I'm nervous, and we're all nervous about, interacting again. And in my haste, relying on my notes too much, I failed to welcome my friend and colleague, Jen O'Connell, to Milton. Wonderful Parliamentary Secretary to Health. MC 101, folks, I seem to have failed. But it is just so cool to have you both here and to listen to how much teamwork went into the last year. We know there's so much work behind the scenes and there's still so much work ahead of us. So thank you, Minister Hajdu, and thank you to the staff and all of the teams who are here as well. Last but certainly not least, I'd like to now invite Mr. Guy Payette, President of Innomar Strategies, to say a few words. Over to you, Guy.
Wow. Quelle belle journée, quel beau moment inoubliable. What a tremendous day and a moment not to forget in our Canadian history. So I'd like to start off by thanking Adam and for his very kind remarks and also for being our Member of Parliament here in Milton. I'd also like to thank the Honourable Anita Anand, the Honourable Patty Hajdu, and for selecting our Innomar Strategies Distribution Centre as the location for today's exciting event. I'd also like to extend a warm welcome to Parliamentary Secretary of Health, Jennifer O'Connell. So, thank you. And our partners at FedEx Express Canada, Pfizer, AstraZeneca, and Moderna. We are honored to have you all here today. In our facility, which has served as the heart of the logistics effort and where our teams have been working to ensure COVID-19 vaccines are distributed from coast to coast all across this beautiful country. This is a monumental milestone for our country and a proud time for Innomar Strategies as we continue to support access for these critical vaccines. When I started this company 20 years ago, around my kitchen table, in Burlington, Ontario, I didn't imagine that we would be part of the government effort to keep Canadians safe. We were laser focused on putting the patient at the center of everything that we did, and we still are today. 20 years later, our focus has paid off. We built our organization, including this warehouse, and this wonderful team here in Milton that has worked tirelessly around the clock to meet the needs of patients and Canadians. And for our role in the vaccine distribution, our focus was on all Canadians. While the scale and the unique temperature control requirements for the COVID-19 vaccines added challenges to the logistics operation, our team was prepared for this moment. This is what we do every day. We are experts in handling the storage of delicate specialty pharmaceutical products, especially those requiring cold chain capabilities. Nous sommes toujours préparés et nous sommes des experts dans la chaîne frigorifique pour la distribution des produits spécialisés en pharmaceutique. Since late December, our teams in collaboration with FedEx Canada have supported the distribution of millions of COVID-19 vaccines to provinces and territories across the country. Constant communication across the supply chain is critical to the success of this distribution effort. We continue to work closely with all our partners to support everyone so that we are prepared for every shipment. Together, we truly created a unique and efficient end-to-end distribution solution for these vaccines. Throughout this global pandemic, our teams have shown tremendous dedication, resilience, and passion as we work through accelerated timelines to ensure that every vaccine that entered our facility was also leaving our distribution center within 24 to 48 hours. Thank you to the Innomar and FedEx team. For without them, this would not have been possible. And thank you to our healthcare workers on the front lines. Your service saves countless lives and makes a difference every day. We are honored to continue to work with the Government of Canada, our manufacturer partners, and FedEx to ensure that our family, friends, neighbors, colleagues, and patients can continue to receive timely access to these critical vaccines. So I would just like to close by thanking everyone today. J'aimerais simplement remercier tout le monde. I'm so grateful for all the dedication and hard work that all the staff here in Milton, our entire team, all the staff and team at FedEx. We've formed a powerhouse to assist and play a role in meeting the end of helping to conclude and get us to a place where we're starting to be able to go outside and enjoy and get back to normal. So, merci beaucoup, and c'est tout pour moi.
Merci, Monsieur Payette, et merci pour votre travail, le travail de votre équipe ici. From day one, Canadians and people around the world have relied on science and expertise and innovation and efficiency, and that is emblematic of where we are standing today, and that's because of your vision and your team's hard work, so I can't thank you enough for that. It's nice that Canadians can take it for granted, that they can show up to an appointment, get a free, effective, safe vaccine, and that's really relied on your supply chain and your ability to deploy millions and millions of vaccines. So thank you again. Can't say it enough. As a double vaccinated Canadian who's just so thrilled that both of his parents are too, merci, merci, merci. This ends the announcement portion of the event, and we are ready to start the media availability. So now I would like to invite James Fitzmaurice, Director of Communications for Minister Anand, to moderate the 20-minute question period. James, à vous.
Thank you very much. As Adam's pointed out, we have about 20 minutes for questions. We'll start with questions from the phone, come back to the room. Time allowing, we'll go back to the phones. Please keep your questions to one question, one follow-up, please. Nous procédons maintenant aux périodes de questions. Nous avons environ 20 minutes pour ça. On commencera au téléphone. S'il vous plaît, une question, une suivi. Et over to you, the operator. Thank you. Operator, can you go to the first question, please? Operator, can you hear us now? We're ready for questions.
Perfect, thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question, Bethany Levitt, the Toronto Star. Your line is open. À vous la parole.
Hi, it's Bethany Levitt from the Toronto Star. Thanks for taking our questions. I wondered if anyone among you is in a position, perhaps the folks from Pfizer and Moderna, to talk about the next frontier on vaccines, which is kids, and when we can expect to see approvals for children under the age of 12 to receive a vaccine, and then further to that, to Minister Anand, our supply of vaccines for that population and where that stands.
Good morning. My name is Fabien Paquette from Pfizer. I'll answer the question related to the current process. We have studies ongoing on the age group that you've defined, so the below 12 years of age. We are planning to complete the phase 1 and phase 2. Phase 2 and phase 3 studies are starting right now for the 5 to 11 years old, and hopefully we'll get some results by the end of this year and be able to submit to Health Canada for their authorization. So that's what we have right now. More data is going to come eventually. The process is going very well with our clinical trials, and hopefully we'll get some results published later on at the end of the summer, early fall.
Thank you for the question. So Patricia Gauthier from Moderna. We are conducting the Kids Cove study for the age of 6 months to 11 years of age. We are conducting a age de-escalation, dose de-escalation study. So it's taking a bit of time to make sure that we have the right data, and we'll be submitting to Health Canada once we have the data available later in the year. So quite similar to what Fabien just explained. We are currently in the process, and the good news is that the Kids Cove study will have sites here in Canada, so there will be Canadian children included in the study as well. Thank you.
And on the subject of supply, we have supply. That's the bottom line. We have sufficient supply of mRNA vaccines for additional age groups as they begin to receive approval from Health Canada. In particular, we have procured in total 51 million doses of Pfizer, 44 million doses of Moderna. We will receive 95 million doses of both of those vaccine manufacturers prior to the end of September. We are working with our suppliers now on the precise timeline for delivery of the remainder of the vaccines that are still left to come in the country, but let's be clear, at the current time, with the 68 million doses arriving before the end of this week, we have enough supply for all eligible Canadians, and the remainder for additional needs that our country has, including additional age groups or boosters if the science deems that that is appropriate. In addition, we have not only been planning for the short term, we have also been planning for the long term. We signed a contract with Pfizer for the supply of 65 million vaccines from that organization once Health Canada approval has been obtained for the years 2022, 2023, and options on 2024. So the bottom line in response to the question is we have enough supply. Canadians should not be concerned about supply of vaccine for additional age groups or additional shots as they may be needed. Thank you.
Stephanie, you have a follow-up?
Yeah, I do, Minister Anand, so don't walk away from the podium too fast. I wonder, as we're seeing, of course, a rise in variants of concern and, this discussion of a fourth wave coming. At the outset of the pandemic, it was a day-to-day scramble for PPE and other supplies, like into the Wild West, I believe, at one point. What's your assessment of how prepared we are now in terms of the supplies and equipment we might need come a fourth wave?
Okay, thanks for your question. What I have been doing on PPE, rapid tests, and vaccines is to make sure that we have sufficient supply in the short and the long term. So, in particular, your question related to PPE, what we did in the first wave of the pandemic was to put into place long-term contracts for the provision of PPE. So we procured 2.7 billion items of PPE. Over 1.5 billion items have been received over a range of categories, surgical masks, N95 respirators, gloves, gowns, you name it, we have it. And we have so much PPE that we have actually procured additional warehouse space. We're working very closely with Minister Hajdu and her team and the Public Health Agency of Canada to ensure that we are getting PPE out to the provinces whenever needed. But the bottom line from a supply standpoint is that on PPE also we are in a very, very strong position. And I will say that at the same time as we were putting into place those long-term contracts for the provision of PPE over the first, second, and third waves, and now into the fourth if that is required, we also focused on building up domestic capacity. And so over 40% of our contracts by dollar value are with Canadian manufacturers of PPE. Last year at this time, we did not produce N95 respirators in this country. As a result of the work at PSPC and with our counterparts at PHAC and Health, we
worked very closely with Canadian manufacturers, and indeed ICED led these negotiations. We were able to put into place a contract with Medicom for the provision of N95 respirators, as well as 3M, the retooling of their Brockville plant. And the work that was done between our government and the Ontario government with 3M to ensure the production of 3M N95 respirators here in Canada further prepares us for any additional waves that COVID-19 or any other pandemic may throw at us. We will never again be in the situation where we need to rely on outside jurisdictions for the provision of PPE. Thank you.
Next question, please, operator.
Thank you. Merci. Our next question, Maxime Huard, Radio-Canada. Your line is open. À vous la parole.
Oui, bonjour. Ma question est pour la ministre Anand. Considérant qu'on reçoit assez de doses pour tous les Canadiens éligibles, est-ce qu'il est temps de parler, de se donner des lignes directrices là, sur la 3e dose ou même de considérer de donner davantage de doses à d'autres pays?
Comme j'ai déjà dit, nous avons suffisamment de doses de vaccins pour tous les Canadiens ici maintenant. Et si les provinces, comme la province de Québec, a décidé d'offrir plusieurs de doses, nous avons les doses pour les Canada. Et ça, c'est une priorité pour notre gouvernement, pour la ministre Hajdu et moi, était d'avoir des doses pour les Canadiens, Canadiennes. Ça, c'est la première priorité pour notre gouvernement. Donc, ce n'était un problème, ce n'est pas un problème maintenant. Nous avons des doses pour notre pays.
Est-ce que vous avez une suivi?
Oui. Donc, si peut-être que vous ne m'avez pas entendu par rapport aux autres pays, là, je veux juste savoir si on considérerait en donner davantage aux autres pays et est-ce qu'on doit craindre du gaspillage de doses si l'engouement pour la vaccination s'essouffle, sachant qu'on a beaucoup de doses, est-ce qu'on doit s'inquiéter qu'il va y avoir du gaspillage?
Je m'excuse. Est-ce que la question est qu'est-ce que nous devons faire pour les autres pays aussi? Oui. Nous avons deux voies. La première voie est d'avoir les vaccins pour les Canadiens, Canadiennes. La deuxième voie est d'aider les autres pays aussi. Donc, nous avons déjà donné plus de 30 millions de doses pour les autres pays. Et récemment, la ministre Gould et moi, nous avons annoncé 17,7 millions de doses d'AstraZeneca pour le COVAX. Et ça, c'est les doses pour les autres pays. Donc, c'est deux voies. Nous devons avoir les doses pour les Canadiens, Canadiennes et aussi en même temps avoir les doses pour les autres pays. Ça, c'est une priorité pour notre gouvernement aussi. Et nous allons continuer d'assister les autres pays en même temps d'avoir les vaccins ici au Canada. Merci.
Please.
Our next question, la prochaine question, Crystal Oag, Global News. Your line is open. À vous la parole.
Hi there. Thank you for taking my question. My question will be for Minister Hajdu. So some premiers have said they won't make COVID-19 vaccines mandatory. Millions of Canadians have yet to get a single dose because of hesitancy. What is the government's plan to curb hesitancy, and are further restrictions for the unvaccinated on the table?
Well, thank you very much for the question. And today's announcement is about enabling provinces and territories to do their job in getting every Canadian possible vaccinated. And we've been there for provinces and territories to help them fulfill their responsibilities in healthcare, whether it is, as my colleague was talking about in the early days, procuring millions and millions of items of PPE, paying for and procuring the vaccines, all the hard work with the manufacturers to make sure that Canadians had access to these vaccines, and we'll continue to be there for provinces and territories to get the job done. at Health Canada and the Public Health Agency of Canada. We continue to work on national media campaigns, as well as a $64 million fund that's being disseminated now to a variety of different community-based organizations that are working in culturally appropriate ways and languages that people understand to help reduce anxiety and fears of people who may not have received that first dose. And let me just tell you about two that I visited in Manitoba last week. One called Women of Color, a group run by Canadian Chinese women that specifically works with other women who speak Mandarin primarily to help them understand the benefits of vaccination, the safety of vaccination, and how it's going to protect their communities. A second, Mamaway Indigenous Health Center, again, working with the Indigenous and urban communities in downtown Winnipeg, providing not just support to understand vaccination, but support for families that are struggling to get access to the center itself. Incredible work is happening out there by Canadians for Canadians, and my job as the Federal Minister of Health is to help amplify that work, whether it's at the provincial level or at the community level. We'll continue to do that till we get the job done.
And do you have a follow-up?
I do, thank you. This is for both Minister Hajdu and Minister Anand. So today you both said that Canada has enough vaccines for everyone who is eligible, which is 2 months ahead of schedule. Now that supply isn't an issue, are you worried Canada will not meet vaccination targets if more and more people are hesitant to getting vaccinated?
Well, I think it's Patty Hajdu speaking. I think for me, my response is, first of all, we've exceeded, as we said, the initial targets that we had. We are now months ahead of our target of having enough vaccine so that every eligible Canadian can have access to vaccination. We're leading the G7 and G20, both in first doses and in second doses, and we'll continue to do that work. In my mind, what I would like to see is as many Canadians vaccinated as possible, because of course we know that this is the way Canadians can be safe about their own safety and to protect their families and communities. Listen, our children, as you heard from the manufacturers, are not able to get vaccinated yet, and we know that they are getting sick with COVID-19 here in Canada and around the world. And my worry as a Canadian health minister is that if we head into the fall and we have too many people that are unvaccinated, it gives the virus an opportunity to infect the people we love. It puts the risk of our recovery, it makes the risk so much more elevated. I last week spoke to so many small businesses in my own hometown of Thunder Bay, Ontario, and the downtown Port Arthur core. Let me tell you, those young entrepreneurs have made it through a very difficult time, and there's so much enthusiasm and optimism, and these are our neighbors that are counting on us to get the job done. So yes, of course, I'm going to stay focused as the health minister to make sure that we can support every player, every immunizer, every province and territory, every community group to make sure we get the word out that this is how we protect each other.
So you asked in the question about our worries, and my worry for the past year and a half was to make sure that we have enough PPE, rapid tests, and vaccines in this country as the Public Health Agency of Canada, led by, extremely diligent public servants, as well as Minister Hajdu and her team, requested on behalf of the provinces and territories who are seeking to provide these items to Canadians. So my worry is to continue to bring in supply of product that we need. That's my role as procurement minister and the fantastic team that I lead at PSPC. And we will continue to support Minister Hajdu and the Public Health Agency of Canada with whatever they need to procure. And one thing that doesn't get mentioned very often is supplies to ensure vaccinations can occur. The swabs, the low dead volume syringes, the needles, the alcohol swabs, the sharps containers. So those are additional items, the fridges, that we will continue to procure. And we'll make sure that we're supplying Canadians and provinces and territories with whatever they need to roll out their vaccine programs or to protect their frontline healthcare workers. And we will continue to support the developing world as well with any supplies that we can. And that's the role that I'll continue to play. Thank you.
Thank you. We'll now take some questions from the room, please.
Hi there, Sean Lee Thong with CTV News Toronto. This is for the Health Minister. Is the federal government considering a certificate of vaccination for citizens that would be accepted anywhere they go?
Well, thank you for the question. And as you know, those are decisions that are being made at the provincial and municipal level, and sometimes at the individual business level. In fact, some organizations have decided, for example, some colleges and universities, that students need to be vaccinated or have a plan to get vaccinated before they can return to class. At the federal level, as you know, we are working with provinces and territories to standardize some proof of vaccination for international travel that may be required by other countries who are looking for proof of vaccination. But the decisions on whether or not there should be vaccine mandatory certificates, those really do rest with provinces, territories, and indeed local public health agencies, as well as in some cases individual organizations.
And as a follow-up, up until recently, airports had been separating people based on vaccination status, and then that changed very recently. Why the decision to change?
Well, I can't actually speak to the decisions about the international airports' operational decisions. I will just say this, though. As you know, we have been adjusting measures at the border reflecting vaccination status. And I assume that the many operators that are responsible for orderly transition through the variety of arrival halls are making decisions based on efficiency and on health principles.
As Health Minister, do you weigh in on that?
No, I have not been consulted on, I believe you're talking about the Toronto International Airport. But we will obviously work with any partner. And so Public Health Agency of Canada has worked with a variety of partners. In fact, we have what's called the Rapid Response Team that has continually evolved to provide support to a variety of different stakeholders. For example, it seems like a lifetime ago, but you may remember the Windsor-Essex outbreak as it related to agricultural farms. The Public Health Agency of Canada had a number of experts on the ground, in the fields, working with farmers, working with workers to make sure that we could strengthen processes and protocols. Our agency continues to offer that support at every level.
Thank you very much. That concludes the question period.
Ministers, Parliamentary Secretary, officials, members of the media, thank you so much for coming to Milton. This concludes today's event and announcement. I can't thank you enough for joining us here for this important day. Merci et bonne journée à tous. Au revoir.